Hello, everyone. It's Wednesday, October the 21st, and since Monday, unless this is just a catch-up from the weekend and they didn't have it in my numbers, but we've lost 14 more great West Virginians. We're up to 413 total deaths now in the state, and I just tell everyone, if this doesn't, warm up to a feeling of caution, I don't know what does. I don't know what does. Over and over I tell you, don't let these people become a number. It's not fair, it's not right. Keep them in your prayers, your thoughts, as Kathy and I will, and we can't let them go unnoticed. We cannot let that happen. We cannot let these people feel alone, and we absolutely need to keep them so close to our hearts because of them and all their loved ones and all those that we need to think about when thinking about our prayers for these great people. The 400th death is a 44-year-old female from Kanawha County. Our 401st death, a 78-year-old female from Clay County. Our 402nd death, an 88-year-old female from Ohio County. Our 403rd death, a 77-year-old male from Marshall County. Our 404th death, a 71-year-old male from Logan County. Our 405th death, a 70, let me go back. Our 404th death is a 71-year-old male from Logan County. Our 405th death, a 70-year-old male from Logan County. Our 406th death, a 90-year-old female from Harrison County. Our 407th death, a 65-year-old male from Brooke County. Our 408th death, an 86-year-old male from Cabell County. Our 409th death, a 62-year-old male from Wetzel County. Our 410th death, an 87-year-old female from Cabell County. Our 411th death, a 76-year-old male from Upshur County. Our 412th death, an 85-year-old female from Harrison County. And our 413th death, an 89-year-old female from Cabell County. Way too many. The other day, we talked about, we were hopeful that the number of deaths in West Virginia were declining. We're still hopeful that they are going to decline. I said at that time that while the numbers on that day through the weekend may have not quite gotten to us, all of them, but nevertheless, I said, we're a long ways from being through, and there's stormy seas still in front of us. Today, our daily percent positive number is 3.36. It's not nearly as bad as it has been, but it's still not good. Our cumulative percent positive is 2.84. Over and over I say the same thing, but many of the states across the nation would give anything in the world to have these kind of numbers. One of the states I saw the other day that their number is their daily positive instead of 3.36 was 37%. It's unbelievable. This killer is all across our land, all across this great country, still with us in West Virginia. Absolutely, it's here. We got to deal with it. The odds are it is going to even get worse as we go into the flu season from the standpoint of a more confined situation to where we're indoors for prolonged periods of time And we have got to really, really just try with all in us. I know you're tired, and I know you're frustrated, but we got to catch another gear, West Virginia. That's all there is to it. Or we're going to have many, many, many more really tough days. Like I said, in the last 24 hours, our daily positivity rate is at 3.36. We had 215 new cases. We now have 5,106 active cases. We have 15,215 recovered cases, the same number of hospitalizations, I think, as were on Monday, 188. Our reproduction number dropped from 1.03 to 1.00. It's the 12th best in this nation. We have 1 red county, Wyoming. We have 4 orange counties today. That's down from 10, and that's Doddridge, Wirt, Pendleton, Wayne, Mingo, and Monroe counties. So we have said it and said it and said it and said it. Please test and test and test more and more and more. The more we test, the more these spreaders we're going to identify and be able to help them, as well as them not contaminating and helping them stop this spread to others. Now, it's taken a little while, but we've got the grants, the CARE grants for our public utilities, worked out now. And I'm going to read this to you and everything. Today is a really big day for a lot of people that are struggling with this pandemic from the standpoint of their utilities. But everyone out there should really pay really close attention to me on this. Today, I'm excited to announce the $25 million that we had bucketed, of the CARES Act relief funds that I have allocated to assist qualifying West Virginians. That's qualifying West Virginians all across our land in paying their utility bills, and it's now all of this is ready to go. This money will go out to the local public service districts so that they can pass it along to our customers of electric, natural gas, water, and sewer utility companies that have experienced an economic hardship and or uncertainty resulting from the COVID pandemic, causing them to have unpaid utility bills from the period of March 1st through July 31st of this year may receive financial assistance to pay those bills. So I'll read it one more time, but I want everyone to pay close attention. Customers of electric, natural gas, water, and sewer utility companies who have experienced economic hardship and or uncertainty resulting from the COVID pandemic, causing them to have unpaid utility bills from the period of March 1st through July 31st of this year, may receive financial assistance to pay those bills. Take advantage of that, West Virginia. We've got $25 million coming your way. West Virginia residential customers who qualify for these funds will be receiving letters with an application from their utility companies in the next few days. Customers must complete and return the application by Thursday, November the 12th. I truly hope and believe that this money will assist West Virginians that are struggling with this pandemic. The chairwoman of the West Virginia Public Service Commission is with us today, Charlotte Lane, and she's joining us for this announcement. So Charlotte, I'm going to turn it over to you for a few minutes.
Thank you, Governor Justice. Good afternoon, everyone. I am Charlotte Lane, and we thank you, Governor, for making this money available to everyone to help them with their utility bills. Governor Justice recognizes that there are thousands of West Virginians who are finding themselves who are forced to choose between paying their utility bills, buying food, medicine, or paying for other essentials. This $25 million of the CARES Act money that has been allocated by the governor will help these qualified West Virginians, and it will make a difference in their lives. Over 133,000 residential customers of electric, natural gas, water, and sewer utility companies who can't pay their bills due to COVID have unpaid utility bills between March 1 and July 31st of this year can receive financial assistance. These customers, as the governor said, will be receiving letters in the next few days from their utility companies. Please open these envelopes and fill out the applications and return those applications to their utility companies or to the Dollar Energy Fund no later than November the 12th. Now, you will be receiving these letters from your utility company. Don't throw those bills away, but open up the envelopes and return them to your utility company or to the Dollar Energy Fund. And we recognize that this generous grant program will not alleviate everyone's delinquency, but the Public Service Commission itself has specially trained consumer affairs technicians who are available to assist customers in negotiating payment arrangements with their utility companies. And the utilities themselves are continuing to work with customers who are behind in their bills and are offering payment plans. And we really appreciate that utilities are continuing to work with customers to help them with their bills. And we really appreciate the fact that the utility companies have not terminated customers during this very, very difficult time. And my fellow commissioners and I would like to thank Governor Justice for making this money available to customers who need help. And our goal together is for people to continue to receive service and for our utility companies to remain strong so that they can continue to provide service to all West Virginians. And once again, I want to emphasize to the customers who are behind in their utility bills and who are eligible to receive this payment that they must send these applications back to their utility companies by November the 12th. And right now I want to turn the floor over to the consumer advocate, Jackie Roberts, for a few remarks. Jackie?
Thank you, Chairman.
Yeah, I apologize. We're getting some feedback. I don't believe we're going to be able to continue.
Thank you, Chairman Lane. First, I want to acknowledge the leadership of Governor Justice in recognizing that unpaid utility bills for West Virginia customers, especially the residential customers that I represent, are a serious problem. The hardship is unimaginable. And in a pandemic, you certainly don't want customers not having water when it's a health pandemic, not being able to have electricity to telecommute. And thank you, Governor Justice. I also want to thank the governor's staff and the chairman of the Utility Commission and her staff for help in putting this grant program together. It was not a simple program to put together, but it is ready for all of you now. I will say that if you know someone who does not believe they have received a letter from the utilities to apply for these grants, to contact the utilities. It may be that the letters are thrown out with the disconnect notices. I understand how that can happen, but you can contact your utilities if you don't see an application in the mail. And please do that as soon as possible. I look forward to continuing to work with the governor and the chairman and the commission and the utilities to continue to find solutions going forward that will help residential customers. And I do want to acknowledge the utilities for their voluntary moratoria on disconnections during this period. Thank you very much.
Okay, if I could just wrap this up one time and just say just this, that first of all, you know, I want to say a special thanks to Mike Hall. You know, he's my chief of staff, and he's, you know, Mike first brought us the situation with the PSC, and so Mike, you know, as we've had to work through the local public service districts and everything, and work through trying to get all the you know, facilitate how we're going to do this and make it all happen and everything. You know, we appreciate you for your efforts and idea, because this will be good and good for lots and lots and lots of people who are having a hard time. Now, in addition to that, it'll be good for our utility companies as well, of which we need more than I can ever tell you. You know, and they've done phenomenal work, and they've bent and they've tried to help and tried to not cut people off and do any and everything that they could possibly do. And a lot of times we just don't give them enough credit. So we thank them for all their great work. But especially I want to thank, you know, the PSC and Jackie, and, you know, what a great job you're doing and everything. And from a standpoint of consumer advocacy and just so many people are putting in the licks and doing the job. But at the end of the day, I'm going to say just one more time, West Virginia families, the ones that are really struggling, the ones that are getting a notice that you're, you know, you're delinquent as far as your power bill or your sewer or water bills and all that kind of stuff, and you know, you're really struggling, you're having a tough go of it and everything. Please don't throw this notice in the trash can. Please just absolutely fill it out, or call someone that'll be able to help you at the utility companies, or someone, you know, you're welcome to call the governor's office here. We'll help in every way and get you to the right people. But please take advantage of this. These dollars are out there for you, and they're out there in a way that you can really clean yourself up from the standpoint of being able to clean away some old bills and everything that are hanging over your head. But again, Mike, thank you. And now if I could go on to some other stuff. And Charlotte and Jackie, great work. Way to go. You're doing really good stuff for a lot of great West Virginians. In regard to our school outbreaks today, we have 20. We have 68 confirmed cases in our public schools, and all that information is up on my website. Our free testing is going on all over the place, especially in any red or orange county. All that is up on our website. And, you know, as far as our drive-through pharmacies, you know, from Frith to Walgreens and on and on and on, we thank everyone that has really stepped up across the state and making that situation easier. And we absolutely need to continue to try to just keep testing more and more and more. It will absolutely result in a very, very good result. So we got to really stay after that. As of today, we've had 43 outbreaks in our there are 43 outbreaks in our long-term care facilities. In our churches, we have 14 active outbreaks in 12 counties. That's Doddridge, Fayette, Mason, Mercer, Monroe, Nicholas, Putnam, Upshur, Wayne, Wetzel, Wood, and Wyoming counties. Again, over and over every day that I'm here, I tell you every day, you know, social distancing, a pew in between you, mask, wash your hands. If you're elderly and everything, you may want to think about whether or not you could skip a couple of church services in person, get some online services or whatever it may be. But really and truly, you know, as we get closer and closer to bad weather, and we just got to be super careful, because church is a place that, you know, a place that a lot of elderly are going, a place where we're really close together, a place where we love to hug one another and embrace and in conversation, a place where we're singing and projecting our voices that projects these germs if we happen to be, you know, infected or contaminated. And so it's a spot that is really needs to be watched and continue to watch very carefully. From our corrections standpoint, we have 12 active inmate cases. That's down, and it is down now to 10 active staff cases. We have 9 inmate cases at the Martinsburg Correctional Center. We have 84 other inmates that have been tested at Martinsburg that are all negative. The flu vaccine is still out there. It's available and everything. I urge everyone to go get that vaccine. From the standpoint of our cities and counties, now we're up to $155,777,276.15 that have been awarded to our cities and our counties. And other than that, I would say just continue to apply, and absolutely, if I could go to our charts just 1 minute, and then I'll be done. If you look at our top chart, we're at 15,215 recovered. We're at 5,106 that are active. If you'll go back in time, that really is bending the wrong way. If you'll go back in time just a little while back, you know, we were at 13,000 recovered and 4,600 active and everything. It's not much different. It's really not much different at all, but it is slightly different and everything. We want it to widen and widen. From the standpoint of our daily positivity, you can see we just keep bopping along on that dotted line and everything, and that is not terrible, but it is not as good as what we want it to be. You know, from the standpoint of our cumulative positivity rating and everything is a 2.84, and that's just holding steady right there and everything, but we really want that to be lower. So, I keep looking at these numbers, but can you imagine in the state of West Virginia, we have done 695,527 tests. It's unbelievable. You know, you've got a population of 1,700,000 and some odd thousand people. We've almost tested 700,000 tests. We got a lot more we need to be doing. And I love it when we're doing 10,000 a day, because when we can start hitting 10,000 a day, we'll be finding these people. We'll be helping them and helping a lot of others, and we'll be saving lives. And so anyway, nevertheless, that's all I've got for right now, and I'll pass it on to our experts.
All right, thank you, Governor. First today, Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to spend my time for comments reinforcing a couple of things the governor said, but also making sure that the good citizens of West Virginia are aware of what's going on, not only in our state, but in our country. You know, the governor has said and challenged us each day to get through our fatigue and our tiredness of, you know, approaching each day with the commitment to protect ourselves and protect each other. We know that if 90% of us wear masks and physically distance from each other and avoid the 3 C's, that is crowds, closed indoor spaces, and constant contact, greater than 15 minutes of contact with people that you don't live with, 6 feet apart or less, then we have the equivalent of a vaccine today. Just think about that. We have that in our hands, in our power. We also know that COVID cases are spiking across the United States. We are reaching all-time daily highs today. Hospitals are starting to fill up around the country. And I just passed forward an article that was published in the New York Times that talks about states and testing. And as the governor said, the fewer the tests relative to the number of tests that should be done, a state does, the higher the percent positive rate, and in general, the more hospital problems they have. And that's what we saw as well when we were just using the infection rate or the incidence rate, which again is a great tool to demonstrate and to tell us what is the spread of COVID-19 in a county or in a state. But it doesn't provide that incentive for us to test, because again, remember, by testing more people, we identify those super spreaders, the small group of people, 5 to 9% of people that infect 80% of others. Oftentimes they infect people before these super spreaders have any symptoms. So the only way to identify them is to test and to do the contact tracing, and in the meantime, protect ourselves in the measures that I just articulated, the governor said, every day. As we go forward, we are one of 5 states in the country that is coming up on the testing percentages and numbers that we should have adjusted for our population. There's 10 states that are ahead of us in the realizing the number of people they should test, but there's 36 states behind us. And it really does reinforce to us on this Zoom call, on this virtual press briefing, and certainly to the governor, that the key for us to get through this and save people's lives. I mean, he read so many names today. It was just heartbreaking. And it is heartbreaking every time we read the name of a West Virginian who's died, when we realize it is in our power to prevent this. It is in our power to prevent this. And these maps, the way that we have constructed the map using both the infection rate and the percent positive rate, is not meant for the map just to be a passive tool to tell us what's going on. It's meant to be an interactive tool that incentivizes us to test, to do the appropriate protection measures, as we've talked about, because if you do that, your color comes down. Our number of tests gets to be one of those 10 states in the country that should meet the goals that we should be meeting. And we're doing a lot of tests, but we need to do more. And we need to double down, West Virginia, because if we wear masks and if we physically distance and if we do the things that we know will protect ourselves and protect each other, your county will turn a better color, but also we'll save people's lives. We will save the lives of the people that we love. And if that's not enough motivation to get going, well, look around the country, because it's getting worse. It's getting worse all around us. And if we don't pay a lot of attention, it's going to get worse right here in West Virginia. So this is the call to action. Run to the fire. Every citizen can run to the fire, just like the governor has committed us and the rest of the resources he has. So join all of us, West Virginia, and it's time for us to demonstrate what makes this state so great, which makes each county so great, each community so great. It is the service and the love that we show to each other. Time to get to work. Thank you.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to give a little update of something the DHHR team has been working on. We have something called a strike team that's aimed towards our nursing home population, and it's basically a team that we have formed to address the COVID-19 outbreaks in our nursing home population. The goal is to, of course, prevent outbreaks occurring in nursing homes, but when we do have an outbreak that is occurring in a nursing home, we have what we call a strike team that will be activated through our Health Command phone call system, and we will go into the nursing homes within 24 to 48 hours. These teams, we have attempted to form a regionalized team within 3 around the state. The team will consist of our National Guard team members, as well as partnerships throughout the state. We refer to them as a buddy system. These teams will have consult teams of infectious disease specialists, pulmonary specialists, as well as nursing home specialist teams. We've partnered with other physicians and consult teams at WVU Medicine, Marshall University, as well as other hospital association members and nursing home specialists. But we've already been acting as such a strike team force within the past couple of weeks to months, but this has been formed. We are working on some funding as well, but did want to introduce that on this briefing as well. And if there's any questions later on, I'll be happy to answer them later on this briefing. Thanks.
All right, thank you, Doctor. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. We want to report that there are 3 employees of DHHR who have tested positive for COVID-19. Have been in the DHHR Diamond Building and 1 Davis Square building. Cleaning was undertaken yesterday at both of these buildings. Those who are identified as someone who has been in contact with these individuals will be contacted during the contact tracing process. Affected areas of the offices were closed and cleaned as warranted based upon the extent of the exposure. Supervisors have notified employees who work in the areas that are specifically being sanitized. We are taking the necessary precautions, working with the local health department, working with our epidemiologist, our outbreak epidemiologist, to assure that everyone is notified of this outbreak and that precautions are being taken. Thank you.
All right, thank you, Secretary. Major General Hoyer with the West Virginia National Guard is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if Dr. Amjad could tell us a little bit more about these strike teams. How does this differ from what we had in place before when we were, running to the fire, so to speak? And are there plans in the works to make other types of strike teams for not just nursing homes? Thank you.
Sure, Carl. The only way they're a little bit different is they're still running to the fire, but we've partnered up with other outside buddy system in a way where we're actually asking kind of volunteer consult teams to participate a little more actively. The local health departments were always running to the fire with us, as well as the National Guard, and they're still participating in the strike team. This is more of a focused group where if a facility has more than 3% of their staff or more than 10% of their residents. So you're looking at a nursing home that is a little bit more rapidly turning into an outbreak faster than you would another nursing home. So it's usually a nursing home that's in a very small rural community that might not have resources as perhaps a larger nursing home. So it's not any different than when we would run to the fire of a nursing home, because we respond very rapidly already with testing. They're testing right away with even one case, but it's in a way that you're going to a facility that might not have the resources that a bigger facility would have.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Forgive me, but a couple of quick questions, if I may. The first was from someone who notified me and asked about vaccines. And specifically, they were asking about the requirements surrounding those vaccines. So if somebody could answer this, what's the plan regarding them? Will they be required for people going to public schools? Will there be exemptions to those requirements? Will there be any penalties for not taking the vaccine? And basically, will the state be requiring all citizens to take the vaccine, or will it be up to the individual? So that's the first question that covers vaccines. And very quickly, the second question, for our healthcare workers, those frontline heroes that we've talked about so much since the pandemic started, the Family First Coronavirus Response Act designated that many companies would have to allow up to 2 weeks paid sick leave for people that were forced to take off work or quarantine because of a COVID positive test. And I've learned that many companies, including Charleston Area Medical Center, are forcing employees who test positive to use their own paid personal vacation or sick time when they test positive. So I'm wondering, why is CAMC exempt from that? And what can the state do about that to ensure that companies are taking care of their employees? So two-pronged question. One about vaccine requirements, two about the Family First Coronavirus Response Act, and why aren't some companies following it and giving their positive employees 2 weeks paid sick leave? Thank you very much.
All right, let me make a stab at trying to answer, the second part of the question, Kenny, from the standpoint of CMAC, and I'm not sure, but I believe that's going to fall under federal guidelines and not necessarily state guidelines. But we'll look into it and see if there's anything other than federal law that we're dealing with here. But from the standpoint of the first question, I think Dr. Amjad and Dr. Marsh have got to answer that.
Okay, I'll go first, Clay, and then Kenny. Kenny, as far as any requirements right now that I'm aware of, no one will be forced to take the COVID vaccine as we're aware of per CDC. And there are also no requirements as far as children are going to school with that vaccine. Those questions have been asked to us in our work groups, in our meetings. But as far as I'm aware of, it's not any requirements, and no vaccine. You can't force anyone to have one even now. And as far as I'm aware of, those have not even been discussed as a requirement for a healthcare worker. Even right now, they're just starting right now to even test the trials in children age 16 and 17. Pfizer has just started now doing trials in that age group. So those are not even on the table right now, but I'll let Clay answer anything more for those questions you've asked.
Certainly, Kenny, thank you for your question. Hein is an expert in this, and I would just point out that West Virginia has one of the best vaccination rates in the country when it comes to children entering the school system because of the rules and the regulations. And of course, we initially want to make sure that we have sufficient vaccine and that vaccine is safe, as it comes forward for all demographic groups and age ranges, including children and adults and older folks. As we develop an effective and safe vaccine, though, one of the real opportunities, and if we look at public health around the world, vaccinations are probably the single most important intervention in reducing preventable deaths and illnesses around the world. And certainly we would be very enthusiastic and start to look at how we can facilitate and make sure that people that might be able to spread the disease to others are able to get vaccinated, and that we can help them understand about the safety and effectiveness of this. But as Ein said, these are early days. The vaccine trials are not done yet. All the people have not been recruited in these different age groups and demographic groups and racial groups. And so we are learning a lot about these vaccines, but more to follow. But it's important that we are very, very committed that as we have safe and effective vaccines that can affect the public health of so many other people, as we've seen, that we create the environment where people will get vaccinated and where we're able to effectively vaccinate our population to the best level possible to protect not only them, but to protect each one of our citizens in the state of West Virginia.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, you've made the argument several times that we're working without a playbook. I would argue back that West Virginia comeback was part of a playbook. The county school map is part of a playbook. As we come up on the 3% positivity rate overall, that was an early benchmark. I'm wondering if there is a playbook on how to suspend some of the things that you have rolled out as far as the comeback goes. Is there a playbook in place on how we're going to deal with the spike that Dr. Marsh referred to that's happening across the country? Well,
Paul, let me take that, Jordan. But Paul, let me say, first of all, I thank you for, I think that was a compliment, you know, in regard to West Virginia coming out with its own playbook. I mean, in the wake of surely not having any playbook on how to deal with or handle this pandemic, and nobody's really had that. West Virginia has really come out with some novel ideas. I mean, you think about first in the nation to test all the nursing homes, all the, you know, residents of nursing homes, the same way with assisted living. You know, we've done lots and lots and lots of stuff like that. But along the way, you know, where does the credit really lie? The credit lies with our experts. The credit lies with all West Virginians as they've stepped up and they've done their job. Now, with that, Paul, we did say right off, you know, long ways back, one of the other things we said was, if we can get our cumulative positivity down below 3%, you know, at that point in time, we'll start easing back and opening up things and really moving in a positive way. Now, all of us know the easy thing to do is shut everything down. But all of us also should know that there's a cost. There's not just a dollar cost. There is a human cost, a physical, a spiritual. There is a human cost to closing things down. I am not an advocate of that. I do not want to do that in any way. But Paul, I would tell you just this, that if, and God forbid, if our cumulative positivity rate gets above 3%, we're going to have to keep on the table lots and lots and lots of different things that we may have to pivot and adjust. You know, Paul, this situation is such that truly from the federal side, from our nation's side, you know, we're going to continue to talk to all the experts, work with the experts that we have. They have been marvelous, beyond belief. They have been ingenious. And so, but Paul, we all know that as we move forward, it's going to get colder. We really don't know what the reaction is going to be to this virus when it really gets colder. We know that we'll be closer together, and that's a big concern. But really and truly, Paul, to answer your question, the only truthful answer is just this, is we'll do what we got to do. I mean, Paul, at the end of the day, that's what we will do as West Virginians. We will step up and do what we got to do in order to absolutely save lives and get through this. And so let's just hope and pray that we don't have a situation to where that positivity number gets there at 3%. But Paul, we all know we got a ways to go here, and we're going to just continue to do all the good stuff that we've already done. And I give all the credit to our experts, to West Virginians. You've done good stuff.
All right, thank you, Paul. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. There were several drive-through flu vaccination events that were scheduled over the last handful of days. They were canceled due to a lack of available vaccine, both through the county health departments as well as some privately sponsored events. As we move forward into the flu season and into the colder winter months, are we anticipating that there may be a shortage of the flu vaccine, or is there still enough to last throughout the season? Thank you.
Matthew, I appreciate your question. I do not think that there's going to be a shortage. I've not heard from anyone there's going to be a shortage of the flu vaccine. But Dr. Amjad, maybe you could comment.
Hey, Matthew. We are keeping track of that, and we do have always been having issues with that every year. There's always some question if there's a shortage, but we're not anticipating anything right now. But we have a lot of health departments looking at them. We were even helping some nursing home get supplies, but we're keeping a track on that daily, but we should be good.
All right, thank you, Matthew. Next to Aaron Williams with WBOY.
Hello, this question's for the governor and the DHHR folks. Since the beginning of the pandemic, in our local reporting, we've relied on the daily COVID numbers from the DHHR. Lately, we've been getting concerns from local residents that the numbers on the dashboard don't match up with what local health departments are putting out on their Facebook pages. Initially, we were dismissing these concerns as people just not reading the dashboard correctly. But the more we've looked into it, we are starting to see some discrepancies. In some cases, the dashboard lists dozens more active cases than the counties say that they actually have. Some health departments that we ask say that they are sending the correct numbers to the state each day, but because they haven't had time to enter recoveries that are sitting on pieces of paper into the DHHR software system, that the most up-to-date numbers aren't showing up on the dashboard. Some of these officials have just thrown up their hands and have told local residents to ignore the dashboard and just rely on their Facebook posts for accurate numbers. I guess the question is, what can be done to restore faith in the dashboard for these folks, and what can we do to help smaller county health departments with their small staffs get the reports entered into the software systems and get the numbers to match up? Thank you.
Let me make a little stab, in the beginning, and then we'll have to defer to Secretary Crouch and Dr. Amjad. But let me just appeal to the local, the rural counties, the local health departments, and so on like that. I can assure you with every fiber of my being that I believe without doubt that there's not been, nor will there ever be, anyone manipulating numbers or holding something back. And absolutely, the only thing it could be is it could be that, there's a day lag, or there's days that are to where individuals, we just don't have the numbers of people, whether they be local or in the rural counties, or they be at our level of DHHR here in Charleston. But I'll let Secretary Crouch and Dr. Amjad, talk with you, but you should have tremendous faith in the numbers that these great people are doing. Now, maybe it's not perfect, but I'm telling you it's transparent, and it is as truthful as I could possibly attest that it is, and you should have complete confidence in these people's numbers and the work these people are doing. At the point in time when there is an issue or a problem, I'll bring it right to the people, and I'll tell the people as point blank as I could possibly tell them. In addition to all this and everything, General Hoyer is stepping up right today. I think he is helping. And General, you could weigh in on this as well. But I think the National Guard is helping 20 of our 55 county health departments today. And so we're, all this is it's not going to be perfect, West Virginia, but I'm telling you, you got some dadgum good people that are working this right here, and you should have a lot of confidence in what they're doing. Won't be perfect, but I'm telling you, they're doing a good job. But anyway, Dr. Crouch and Secretary Crouch and Dr. Amjad and General Hoyer, y'all weigh in on this.
Yeah, thank you, Governor. This is Bill Crouch. As with any data system, it's only as good as the data that goes into the system, and the data is good. We are as transparent, as the governor said, as you can possibly be. There is a lag with regard to the cutoff at midnight of data going into the system. We run that data through the system into our surveillance, from our surveillance system to the dashboard every morning. Some of that data has not been vetted, as we've talked about. The local health departments have to do investigations to determine if the county is the right county, if there's duplications of cases that have been entered. I've also talked about the issue of paper and still getting faxes from companies, lab companies in and out of West Virginia, but primarily out of West Virginia. One of the things we saw last week was an influx of actually of 4,000 additional cases that came in because we got Rite Aid and MedExpress and a couple of other companies who do those labs hooked in electronically. So as those companies come online in West Virginia, we move very quickly to try to get them hooked up electronically so that file goes to the local health department and goes to the state health department. So the local health departments they're exhausted. They're doing a terrific job. As the governor said, the Guard is assisting a great number of local health departments. I was on a call with them last night, as was Dr. Amjad late, to talk about their needs and what we were doing and what they were doing. The issue of recovered cases, we've had 2 meetings about that this week. We're also very concerned that those cases are not being cleared. That is a function of the local health department folks to put an end date on that file to show that that case is recovered. And until that's done, it doesn't come to us as recovered. So that's one of the big issues with regard to the differences. We're actually looking at how we can do that for them electronically to take that workload off of the local health departments. It's a burden, but it's a necessity in terms of getting an accurate count of recovered cases. So I want to thank the local health departments that those folks are working very hard. Thank the Guard for assisting. We will continue to try to make changes as we move forward to make that data as accurate as possible. And again, we'll always be transparent with regard to this. Thank you.
Governor, I can also add to that, as you pointed out, we're supporting through DHHR 20 local health departments right now. The leadership team has a liaison, Dr. Deb Keister from Marshall University, who's the liaison for all the local health departments. So if you look at 49 of the local health departments with the combined regional ones, we're supporting 20 right now. We also have over 75 personnel supporting DHHR and the local health departments with epidemiology support. And we are prepared to surge where needed in other counties.
All right, thank you, Aaron. Last question today from Joe Severino with the Charleston Gazette-Mail.
Hi, everybody. I'm relaying this question from Katie Coyne. Governor, you said that having more local control in pandemic response would be difficult because you don't want 55 counties operating differently, but several county officials and health officers from across the state have expressed interest in doing exactly this. Would you be willing to have a conversation with local leaders about giving them more power to respond in tailored ways when they have spikes in their counties? And then from an epidemiological standpoint, Dr. Marsh or Dr. Amjad, is there any advantage in not allowing county health officers to have certain limited powers they could use to mitigate the spread of COVID-19 in their own counties? Thank you.
My answer is really simple from my standpoint. You know, we're talking to these counties, the county local health departments nonstop. We want to take any and every idea and try as best we possibly can to do one thing, and that is just this. We want to make it better. We want to make it absolutely better where we have spikes and issues, and we absolutely want to save lives and try to do any and everything we can do. But let me just say this. What has made us strong? What has made us strong is one thing. We have stayed together as West Virginians. Really, there is 1,000 different ideas on how to address each and everything under the sun here. And if we get running in 1,000 different directions, we'll have issues. Sure as I'm sitting here, we will have issues. We have issues to deal with right as we speak and everything. But we have got a great resource of real experts here, real experts. And in all of that, you know, what we want to do is not impose our one size fits all on anybody. We want to take their input, and we want to absolutely learn from their input, and we want to continue to talk and try to just make things better and better and better. That's the right answer. But we have got to some way try with all in us as best we possibly can to all of us stay together. You know, that's the simplest and most direct answer. And no matter what anybody would say, I know at the end of the day, if we continue to communicate and listen to others and everything and modify and make things better and stay together, we'll be better off.
All right, thank you, Joe. Governor, back to you.
Well, let me say this. You know, today, you know, Dr. Marsh, you know, you see a gentleman there that, like I said, he's ingenious in many ways. His intellect is off the chart, and his passion for all of us in West Virginia the same. Now, most days you hear him talk, he's a voice of calm and a voice that is absolutely reassuring and calm. Today, I thought you saw a little bit of a different side of Clay. Now, Clay's a man of action, there's no question whatsoever. But today, I saw a side to where he was calling us as West Virginians to run to the fire. He said it. He says it's time to go to work. Well, we've all been at work, Clay included, and everyone is a level of tired. But he is saying to us just this, and absolutely he is dead right. People are dying. If that's not enough to call us to action even when we're tired, even when we're weary, if that's not enough, I don't know what enough is. You know, our great military, our great veterans, our great active military called themselves to duty. They were tired. They were probably hungry. In a lot of instances, they were cold. What did they do? What did they do? They stepped up for all of us. So many times, great Americans have done just that. Clay Marsh, a gentleman of incredible intellect, is telling us today that as we go forward, the odds are this could get worse. And he's also telling us right in our hands right now, we have the vaccine. The vaccine is our mask. The vaccine is absolutely following guidelines. The vaccine is in our power right now to stop this. He's calling on every last one of us. I loved his passion, and I would echo the same thing. Please, please, West Virginia, I know you're tired. I know you've worked. I know absolutely that you're frustrated and confused and all those feelings. But he said it's time to go to work. It's a tough, tough, tough call. It's a tough call, West Virginia, but come on. We can do it. We can get through all this. Just hang tough. We're going to get there. But we got to catch another gear because we got this terrible killer and it doesn't want to go away. We've got to drill it right between the eyes. That's all there is to it. And we can make it go away. I'll promise you, if we step back and lay one right dead between its eyes, we'll make it go away. All right, thank you.